Hi guys, today we have a cystotomy in a 4-year-old small judo. So we are preparing for the anesthesia. The indications of cystotomy are blunt trauma to the bladder and bladder rupture. Again, the common indication is bladder stones or urolithiasis. Then we might have TCCs or bladder tumors, which can cause hematuria and all those signs. Ectopic ureters. Now we are starting with the cystotomy for removing a giant, what we think is a giant bladder stone. So let's see the surgery.
Oh man. Yes.
This is the inflamed ureter, so it's causing really high back pressure towards the side of the kidney because ureter is not being able to empty the urine from the kidneys. Obviously, kidneys are located here and the ureters are supplied to either side of the bladder. So these are inflamed because obviously the stone is really big and it's not being able to push that urine. So I'll need a bigger incision actually.
That happens because obviously the bladder can't express itself.
Yes. So if you imagine the position of the dog, this is the ventral surface, this is the dorsal surface, these are the ureters.
Get to jump over here.
Yeah. So it's best to use lap sponges on 4 sides. Obviously the urine or the contents in there are heavily infected because being a female dog, the most probable cause of stone is a urinary tract infection. So it will be like full of bacteria. So we also need like a sterile saline. All right, I'm going to cut it.
Jar, please.
So this is obviously the infected urine, but there's nothing much in there. Wanna just tilt it up and then.
Oh my gosh.
So that's the stone. If I touch it, I should change my gloves obviously.
Yes.
Because
Open this for me, please. What's up, homie?
I want to see this. Holy shit, how long is something like that going?
I have no idea. We don't need water. We don't need water.
You don't need the water.
No. As dry as possible, yeah.
Changed his gloves to a new pair of gloves after handling the stone.
I drop in BP now that the stone is out. Do you want me to bolus once
Mhm.
if she gets to the 50s?
Yeah. Do what you need to do. No problem. So we have 2 stay sutures just to pull the bladder like this. So I'm going to use 2 hemostats to just like pull the bladder like this and just use the pressure of the hemostat just to keep it there. So now get up.
That's
So now the most important thing is how to suture the bladder. Bringing or making the bladder watertight is the most important thing. So zoom inside. So this layer is the endothelium of the bladder. This is the muscularis. So this is a muscle layer. This is the endothelial layer. And this is obviously the serosal layer. So the suture material should not penetrate the bladder. Otherwise, it will act as a nidus for the stone formation, right?
Okay.
So suture, anything like which is artificial, should not touch the urine. So again, that's why we are. Yeah, it can like enlarge really big. You know, now it's not elastic because of that stone. So right now, after healing, it will be really elastic. The suture that I'm going to use is simple continuous. So should start somewhere around here, not on the actual wound, but here. And again, it should not penetrate. It should not penetrate the lumen, because then there will be another stone after like 6 months. So, all right. So I'm not putting any pressure, just a stable knot. And
these are dissolvable?
yeah, these are dissolved. Will never go inside again. 3, 4, 5.
Fun part.
All right.
Awesome, thanks, Doc.
So 0.3 millimeter bites. 0.3 and 0.3. And after every bite, you have to redirect the node like this. Again, as you can see, I'm not penetrating the exactly 0.3. So we are getting great closure. It's my third stitch. After every stitch, keep your instrument like this and kind of direct it so that it produces uniform tension. Beautiful. This is the apex of the bladder or the corner. Again, put uniform pressure so that it's kind of uniformly closed, and I'm gonna close regular closure, 1, 2, without putting too much pressure, without tearing the bladder, obviously. Don't put any pressure because it's going to tear the bladder. So it's very, very delicate, sensitive tissue. Six saws like I used here. So right now we finished the first layer. Some surgeons stop here without going the second layer, but for additional security we are going one more layer. So you see, I think it's airtight right now. There is some urine already forming in there. but just one more layer for additional security. So for that layer, yeah. For that layer, we are going here. It's called as Cushing's. Cushing's suture starts here without disrupting any blood supply, obviously. Like this. And then in my next suture, I'm going to bury the other stitch. So,
get some saline mark.
see?
Bladder has been filled with saline for leak test.
No leaking. A good amount of pressure. Nothing leaking. Right? See that?
Agreed.
Okay.
Bladder has been flushed and is ready for placement.
So we are closing the linea alba after placing the bladder in the abdominal cavity. Okay, stop.